Okay, today we're going to be evaluating a 28-year-old male for shoulder pain. Hi, I'm Christina. I'll be doing your evaluation today. Can you tell me a little bit about what's going on?
Yeah, my right shoulder's been hurting.
Okay, and how long has this been occurring?
Just a few weeks.
Okay, and where exactly in your shoulder is it hurting?
Right there.
And is it just your right shoulder or both?
Right shoulder.
Okay, are you having any joint pain anywhere else?
Nope.
All right, and how long does this pain typically last?
About 30 minutes. When I'm using it, it'll hurt for about 30 minutes afterwards.
Okay, and does it tend to go away on its own, or do you think
Yeah, if I don't use it, if
Okay.
I don't move my shoulder, it goes away.
Okay, so using it makes it worse. Does anything else kind of aggravate it or make it hurt worse or kind of precipitate the pain?
Just using it. No, that's it.
Okay, and what about alleviating factors? I know you said when you stop using it, it kind of goes away, but does anything else help, like ice or heat or any medication like ibuprofen or Tylenol?
Ibuprofen. That usually helps.
Okay, good. And when you're having the shoulder pain, does it radiate anywhere?
No.
Okay. And you said when it happens, it lasts for about 30 minutes or so before it goes away. And when you are having this pain, do you notice any events right before that may trigger it or cause it to happen specifically?
Mm.
Okay. And has this ever happened before?
Yeah, about a year ago.
Okay. And what did you do for that to help it?
I didn't do anything. It just ended up going away.
Okay. All right. Well, tell me a little bit about your medical history. Do you have asthma, diabetes, hypertension?
Yeah, hypertension.
Okay. And what medications are you taking?
I take lisinopril.
Okay.
Yeah, every day.
Okay, good. And what about your family history?
Mom has hypertension, and dad has hypothyroidism, or hyperthyroidism. I don't know. And then brother, alcoholism and drug abuse. And grandma has arthritis.
Arthritis? Okay. Does anyone else in your family have any type of issues with their joints besides your grandmother?
No.
Okay. And what about any allergies?
No.
Any medications?
Nope.
Seasonal allergies?
Nope.
Okay. And what about your social history? Do you use tobacco, smoke cigarettes, marijuana?
No, I don't. Drink a few beers every now and then.
Okay. All right. And do you have a pretty good support system at home?
Yeah, I do.
Good. And what do you do for exercise?
I exercise. I lift weights.
Okay. And does that affect the pain?
Yeah, that's when it usually hurts. It's after I lift.
Okay.
It starts hurting during lifting, and then it hurts for a while after lifting.
Okay. Are you able to push through? Keep going?
I push through, but it doesn't feel good.
Okay, gotcha. All right. Well, have you, along with the shoulder pain, been having any like fevers, chills, any weight loss that you've noticed?
Nope.
Okay. What about any swelling, maybe rashes, bruising, lacerations, that kind of thing?
No, just I think there could be a little bit of swelling, but
Is it
and just
pretty
tenderness.
noticeable, or does it swelling kind of come and go?
So it just comes and goes.
Okay. And what about any numbness or tingling in this arm?
Nope.
No? Okay. And you said you did have pain and tenderness here. Do you ever have any issues with your range of motion or moving your arm besides the pain?
No.
Okay. All right. Well, for my exam, I'm going to go ahead and assess your arm here. I'm going to assess the pulses distal to the site of injury. So I'm going to check the radial pulse here. All right, and it is a 2+, regular. I'm going to look at your hands here, just kind of inspect the whole arm as well as that distal to the injury. Color is good. Check cap refill. All right, less than 3 seconds. Have you noticed any numbness or tingling in this arm at all?
Mm-hmm.
Okay. All right, so I'm just going to inspect the, can you turn this way just a little bit? Okay, thank you. I'm just going to inspect the anterior portion of the chest. Looks symmetrical, no abnormal or no deformities or abnormal contours. Right shoulder does appear to be a little bit more swollen compared to the left, no atrophy. Swing that way a little bit. little bit more, please. Thank you. Okay, I'm going to just kind of inspect the posterior side of the upper back and shoulders. Looks symmetrical, color is good. Again, a little bit of swelling to the right shoulder here. No redness, no warmth. Okay, go ahead and turn back around. Perfect. Okay, I'm gonna go ahead and palpate here. Turn this way just a little bit. Okay, I'm gonna start at the sternoclavicular joint and move across the clavicles here up to the acromion. I'm gonna feel the AC joint on both shoulders. And for purposes of the video, everything on the left side is going to be within normal limits. Let's see, just feel around the bony contours, up around to the front, to the clavicle, and if you turn around, again, let's see, I'm just going to feel, you turn a little bit more, just in your legs, thank you. So, let's see, I'm gonna pull this back a little. Okay, so if you start midline, you can kind of feel the borders of the shoulder blades or the scapula, and if you go up, you can go laterally back up to the shoulder, the acromion process, AC joint again, the coracoid, and the greater cervical. Okay, go ahead and turn back around. And I'm actually going to have you stand up here if you can, and we're going to do some range of motion testing. Back up a little just yep. So you have room. Okay, what I want you to do, we're going to do some flexion, extension, abduction, rotation, and internal or external rotation for these first measures. Okay, so what I want you to do is bring your arms up over your head. Any pain? Mm-hmm. All right, bring them back down. And if you can, turn to your side a little bit. We'll do extension. I want you to bring your hands behind you. Okay, and back. Any pain? Nope. All right, good. Now, can you bring your arms? Let's see. I'm trying to make sure you have room. Bring your arms across your chest here. And this is also a cross arm test. Any pain? A little bit. Okay, now to your left arm. Okay, good. Now, I want you to take your hand and put it behind your back like this for internal rotation. Okay, and do the other one. Okay, any pain there? No, not that one. Okay, now I want you to reach up like this. Any pain? Yep. Okay, and come back down. Okay, so I want you, so that would be a positive Apley's test. With the, let's see, we're going to do Neer's test, and I want you to train these spots here for the video, face the video still. Okay, so this is a Neer's test. I just want you to relax. I'm going to stabilize shoulder up here, and I'm going to lift your arm. I want you to tell me if you have any pain or not, okay? Yeah. Okay, good. Come back down. And I'm going to come this way. Okay, so that would be positive, positive Neer's test. And for empty can, I want you to turn your hands like this, as if you're emptying out a can. Okay, and I'm going to push a little bit of resistance here, and I want you to let me know if you are having any pain or not, or trouble holding your arms up. Yeah, a little bit of pain. Or no. No. Okay, good. So negative empty can test. And then we are going to do the arc test, and I want you to put your hands by your side, and then I want you to come up and go up all the way if you can. Oh, I can't. It hurts. It hurts? Okay, yeah. Bring it back down. So that is a positive painful arc test. Now, I want you to do, I guess, I'm trying to think. Here, stand like this. Go ahead and put your arm up like this. This is going to be an apprehension test. I'm going to stabilize the shoulder joint here and kind of push backwards. Any pain with this?
Nope.
No? Okay, good. And let's see, we're going to do a laxity test. So I want you to, trying to think, laxity test, keep your arm turned this way a little bit. So I'm going to, I guess I'll do it this way. Okay, I'm going to stabilize the arm here, and we're going to assess for any instability within the joint. And it feels pretty stable here. And we're also going to check for the sulca sign by kind of pulling down. Again, it feels pretty stable, so these are negative. And we're going to do a, for the last one, we're going to do a drop arm test. So what I want you to do is raise your arms up this way. I'm going to apply a little bit of pressure. All right, any pain or tenderness, trouble keeping your arm up? Okay, now turn this way. I want you to bring your arm up again, except I want you to let it down slowly. Okay, good. A negative drop arm test. And for my differential diagnoses for this exam would be glenohumeral instability, rotator cuff tear or tendinitis, and the AC joint sprain. Thank you. It's not stopping.